All right, quick video on renal calculi. Renal calculi is just a fancy word for kidney stones. So what causes kidney stones? It could be hyperparathyroidism, which leads to hypercalcemia. Their relation is most kidney stones are made up of calcium. So if you have hyperparathyroidism, odds are you will have hypercalcemia as well as kidney stones. Another reason for developing kidney stones could be a family history, an obstruction, or dehydration. So what are the signs and symptoms of a patient that comes in with renal calculi? They could be sudden onset of severe, when I say severe, I mean severe flank pain, to the point that it could bring a grown man down to his knees. I've witnessed it in the ER and it is very severe pain. So keep that in mind. Other signs and symptoms include nausea and vomiting, low-grade fever, frequency, as well as gross hematuria. So if I take that urine sample up and I look at it, I will see red urine. So gross hematuria. So how do we treat it? Obviously, we want to treat that pain. So you want to give opioids to treat the pain. We don't want those patients to suffer. It's going to increase their heart rate. It's going to increase their anxiety. They're going to be all over the place, restless, just because the pain is so bad. So treat the pain. Increase fluid intake over 3,000 mLs per day. Assess for low-grade fever. Treat the fever if they have one. You want to encourage ambulation. The other thing that you want to do is you want that patient to turn from side to side. You want to reposition that patient so that that stone can start moving down the urinary tract and exit. Once the stone is out, we want to strain that urine. The reason is we want to locate that stone and send it up to the lab so that we can identify what the composition of this stone is. Is it calcium? Is it purine, such as sardines? Is that the problem with the diet? Or is it oxalates, such as spinach? By identifying the composition of the stone, then we can target the treatment to specifically affect that type of stone, such as calcium. We want to decrease the amount of calcium in the diet so that your patient doesn't have any further problems in the future with developing more stones. So there you have it, guys. That's all you should know in order to treat your patients with kidney stones. Signs and symptoms, composition, interventions. If you have any questions, reach out.